Hi, and welcome to the DySQ study. I'm Dr. Neelam Khurana. I'm a general pediatrician and part of the team that's created the Dyslexia Screening Questionnaire, or as we refer to it, the DySQ. Our team includes physicians, speech therapists, and dyslexia reading specialists. Thank you for supporting our mission to validate a screening tool for pediatricians to detect the signs of dyslexia in 6-year-olds. The long-term goal of this research is to establish a dyslexia screening questionnaire as a routine screener for the 6-year well visit. Our objectives include providing you with education, resources, and tools to better understand dyslexia, complete preliminary research to validate the DySQ, with a long-term goal to change the standard of care by adding dyslexia screening as part of the school-aged child visit, and to support your patients with dyslexia. Together, we can help our patients reach their full potential by knowing signs to look for and what to do with those early signs of dyslexia. As pediatricians, dyslexia is a topic that most of us have not received training on. We often have families ask us to provide the diagnosis for their child to receive accommodations in school. Most of the time we tell our families to go back to the school, or we send them to a neuropsychologist if they can afford it. We often rely on the schools to screen and diagnose dyslexia, but their screening is often limited and incomplete. What is dyslexia? We commonly know of dyslexia as flipping letters, but it is much more than that. Part of it is a reading disorder that is found in persons with a normal nonverbal IQ, but an inability to change our three-dimensional world onto a two-dimensional piece of paper. At the end of the presentation, I have a link that describes dyslexia in detail for providers, along with the website with additional information. What we know is that dyslexia is more than an educational problem. It is our problem too. Our job is to help the whole child, and if we don't help them with this, it leads to many long-term consequences, including mental health problems, misdiagnoses, and an inability to achieve the full potential success in life. Did you know that 40 to 60% of dyslexia is inherited? Parents have lots of information that they can provide regarding their child's early signs of dyslexia. All we have to do is tap into that information. Many of you already screen for autism and other developmental delays up through 5 years of age. With your help, we can expand developmental screening into the school-aged child and identify risks for dyslexia in the 6-year-old patient and help the 15 to 20% of children with this learning disability. Here's how easy it is. Your participation will require very little upfront work. All you must do is place flyers in your office, talk to parents about the study, and then once we complete the rest of the steps, you and your patients will have results of their testing, as well as more education on this topic for the future. We are asking you to place flyers in your office and reach out to families via electronic communication. If you have a 6-year-old in the office or the caregiver of a 6-year-old child, we ask you talk to them about joining the study and lead them to the flyer with the QR code. Place it in all places that will be visible to families: waiting rooms, exam rooms, restrooms, check-in and check-out desks. Interested parents just scan the flyer's QR code and follow the link to get the electronic invitation, and the rest is done by us. Who is eligible to participate in the study? All 6-year-old patients within your practice, except for patients with other delays that do not allow them to meet the criteria for the diagnosis of dyslexia. These include global developmental delay, cognitive deficiency due to underlying medical conditions, autism spectrum disorder, hearing impairment, conductive, sensorineural, or mixed, uncorrected or uncorrectable vision impairment, other formally diagnosed learning disabilities that would interfere with the ability to diagnose dyslexia, or any significant psychiatric illnesses. Once the flyers are placed, we would like all providers to talk to parents about the opportunity to participate in the study. Please take any opportunity to invite families. If the patient is there for a 6-year well visit, if a 6-year-old patient is present for a sick visit, if a patient who is being seen has a 6-year-old sibling. Additionally, you can also reach out to them through your organization's patient portal or email or any other large-scale outreach to all 6-year-old parents. They do not have to be present for a well visit. Some phrases you can use to say to parents of an eligible 6-year-old: participate in a free evaluation that helps identify if your child has reading difficulties. The study is created by a team of doctors, speech-language pathologists, researchers, and reading specialists. It is not an official evaluation, but if your child is identified at being at risk for a reading or language disorder, you will receive resources to support your child. Also let them know that if your child is eligible to participate, you will get a $25 gift card for your time. This is a sample of the email template that you can use when communicating electronically to your families. There will be a Spanish translation within the same email, and we will send the email in a format that will allow you to just forward it through your electronic means of communication to families. This flow sheet gives you an idea of what will happen after providers have recruited families to participate in the study. The caregiver will scan the QR code to watch a short video explaining the process, followed by a quick survey that will determine their child's eligibility to participate in the study. If the child is eligible, the parent or guardian will be prompted to fill out the consent form and their contact information. The caregiver will then be able to immediately access the dyslexia screening questionnaire. Once they completed the questionnaire, the ASU DISC research team will reach out to the parent and schedule an evaluation of language, phonemic awareness, and reading. This testing can be done in person or virtually. After the team has completed the full evaluation, they will receive a $25 gift card for their time. The evaluation will be written up in a report and sent to the primary care provider and to the family. For those that show a risk for dyslexia or language difficulties, they will receive a written resource with guidance on the next steps. Parents may choose to come back and review the results with you, or they can move forward with all of the information we have provided them. Providers will have additional resources to help their families with the next steps. We understand that most of you have little to no training on dyslexia. We are here to provide you the information you need. The results of their evaluation report will include a summary of what test results mean and recommended next steps in a brief written report. We will provide guidance to providers and caregivers on the next steps, including additional resources. Once the child has completed the evaluation, you will receive the results of any evaluation at the same time that the parents will. The parents have the information from our reports and can move forward with that, or they may come back to see you to discuss the results and determine next steps. So we want you to feel comfortable and well informed on how to proceed with the report and discussions with the families. As we move forward past this patient recruitment phase, our team will be providing you education on how you can interpret the data from the study to help your families. Next steps as we go through the process so you feel comfortable and guided on taking on this role. Resources for your patients to receive formal testing and an official diagnosis of dyslexia if they choose to. Resources on how patients can get treatment with or without an official diagnosis. Education and resources that will help you move forward beyond this study to help your school-aged children. To know a bit more about dyslexia, I have created a video for providers. You can go to the Webinars tab on Dr. Karana Baby 101 and play the video under Dyslexia, or click the link from this QR code. Additionally, the website has more resources and information about dyslexia for providers, but we will also be providing you with additional resources directly as we move through the study. Thank you for your time and dedication to make a difference in so many lives. If you are interested in participating in this study, please email me directly to obtain flyers for your office and begin recruiting 6-year-old patients. Thank you again for your interest. We are excited for you to join us in helping school-aged children reach their full potential.